My name is Dr. Jim Krause, and I am a professor at the Medical University of South Carolina, and I'm going to be making a presentation today on utilization of a labor force participation model in the assessment of quality employment outcomes among those with MS. And I have several co-authors, people who have contributed to this. Dr. Philip Rumrill at Kent State, Libby Dismuke, who is a member of our research team, and she has done some of the econometric modeling. Dr. Joe Terza, who is our econometrician, and he's done the major modeling that we're going to talk about today, or at least one set of the models. And Melinda Jarnicki, who is a great team member and who's worked with our MS research on employment since its inception. Next. I also have Christian Manley helping me, who you may not see. So I'm going to go through the presentation today, and as I change slides, it just takes a minute for it to come up, so I will have a little pause between slides. So I first want to give the acknowledgement that this information as a product was developed for the Rehabilitation Research and Training Center on Employment After People with Physical Disabilities at Virginia Commonwealth University. I'd like to thank our colleagues there, and the lead folks, Paul Wayman and Caddy Inge. And also the contents of this grant were prepared under the grant from the National Institute for Disability Independent Living and Rehabilitation Research. And that is within ACL and Administration for Community Living in Health and Human Services. And we are truly grateful for this opportunity. Next. I also want to do a secondary acknowledgement, and that a portion of the presentation was funded through, or a portion of the research cited through a healthcare delivery and policy research grant from the National Multiple Sclerosis Society, and this is under Dr. Phil Rumrill. We've been fortunate to be able to merge the data from the two lines of research to make it a more interesting and comprehensive presentation. So MS is a very common neurologic disease, affects approximately 2.3 million people worldwide, and about 450,000 in the United States. It's a disorder of the nervous system. It's characterized by symptoms such as fatigue and trouble with concentration. Also, a variety of physical symptoms may be present. It is more common in women than in men, and occurs most common to whites. We do a lot of research with spinal cord injury where the demographics are quite different. And so as we've gotten into this work with MS, it's been very interesting to note the differences and potentially their effects on the outcomes that we're looking at. And employment is a hallmark key outcome in anybody's life, as is salary, earnings, what we get from for our work and for our time and effort. Next. So MS typically occurs between the ages of 20 and 40, and 20 and 40 are very active years for employment. So this is the time when most people are really developing their careers, very active in the labor force. And we are going to look at today a little bit the timing of the MS onset and some of the outcomes. So the existing research has shown that as the illness progresses, there's a sharp decline in employment with estimated 20 to 30% people employed 15 years after diagnosis. And you will be able to see the decline that is discussed here in our research. It is paralleled in our research. And of those who've left the workplace, the current research suggests most people have left voluntarily, although most believe they are able to work and would like to re-enter the workforce. So we do have a lot of people leaving for reasons related to the MS, and still maintaining some hope of returning to the workforce. Apologize for the background noise there. Next slide. So earnings and multiple sclerosis, due to the long-term consequences and some of the complications, there are elevated lifetime costs in MS. And one study has estimated that the cost of living with MS is approximately $70,000 or more per year. So it's very costly, and therefore employment is very important because you need the resources economically to pay for those costs and often the benefits. A lot of our research, or a portion, has looked at benefits, and that's not something we're going to be talking about today, but something that you can access from looking at previous webcasts and State of the Science presentation on MS. Well, there is an increase in cost. Research has shown that there's actually a decrease in earnings. And one study found that 53% of people with MS reported lower pay compared to their peers. So that clearly is not simply an issue of maintaining employment, but maintaining and making a strong living wage. So MS having a component of physical disability, estimates of employment with people with disability are quite diminished compared to the general population. This is one estimate that we're presenting here, but we have seen progress in over the last year, but clearly there remains a dramatic gap depending on the diagnosis and the symptoms, and certainly people with MS, depending on the number of symptoms and severity, are going to have depressed employment outcomes as a group, with individual variation for different people. So employment is very important. Employment, it brings intrinsic rewards. It gives us purpose to life, gives us a very meaningful way of spending our time, doing things. Feelings of accomplishment are all part of being employed. And it also provides the extrinsic benefits that we all know we need. We need salary, we need benefits, we need insurance, and employment does that. And so MS and other disabling conditions, they present a significant barrier to employment and obtaining new employment. So I want to talk about studies in quality employment and disability. And this is our area of research. So our fundamental belief is that the programs and the focus of research, when it's been solely on employment rates, is simply just not accounted sufficiently for the quality of employment. So we constantly hear about where the employment rate is related to the general population and the portion of people going either returning to work after the onset of a condition or being able to retain employment. But we don't hear as much about the quality indicators, and certainly within the general population and for people without disabling conditions, the quality of your employment is a central issue. What are you getting? What sort of salary? What type of position? The progression and recognition, all of those types of things. So measuring the quality of employment reflects the diversity of outcomes that occur related to employment. And quality indicators can be quantified by the intensity of labor force participation, how many hours people work, how many jobs they've had, the age at which they retire, or the type and quality of employment. So what level of position is it, and how does that meet with what the individual's hopes and goals are? So our program goal, the program of quality employment after disability, is really related to guide development of policy decisions to maximize resources available to promote employment outcomes. So there's only so much of a pie, and the size of the pie isn't going to change very much. And so it's how you slice it. Believe it or not, I didn't rehearse that. But it really is, and so when VR and other resources are used, it's important that they really are maximized to promote the best employment outcomes. And a lot of the attention goes to promoting employment rates. But when those rates become stagnant, as they often do, there still is the opportunity of doing things with those who are employed, who have disabilities, who have MS or other conditions, to help them to maintain their employment, to move up the ladder, and to do things that promote their career. So within our research program, what we feel we've done is we've developed the blueprint for investigation of employment and disability. And what that means is we started with one population, and that was spinal cord injury. And we then adapted our assessment with as much common items as we could, common content, common outcomes for people with MS. And we have had over 3,000 participants between the studies. I'm only going to talk about MS today and those 1,300 participants. But basically, we feel like we have a blueprint that can be applied to different populations, and then as new populations are added, there's comparability to each other in the sense of looking at the comparisons, seeing the types of barriers and facilitators or outcomes. And again, some of that's beyond the discussion today, but do want to let people know that that is the nature of the research program and its goals. And we very much anchored our work on existing national data sets that are widely used to look at employment and disability, but done so very broadly, more with general categories of disability based on single items rather than the detailed look at disability like some of the things we'll look at today in terms of complications and how those affect employment. So the labor force participation model that we use itself was developed as an adaptation of a model that we had developed much earlier to look at a health-based model to help us conceptualize and guide our selection of variables for prediction of health outcomes. And we have looked and identified its applicability, modified it so we can now do this related to quality employment, and that's what we've been doing. So this is a view of the labor force model, and so this is a conceptual model. So this is not necessarily all the parameters that we have in the current model, and not each of these parameters is necessarily represented, I said model, in the current data. So this is a lot of areas and really too much to encompass fully in a single study, although we have certainly done our best to incorporate as many areas as possible. So what you will see within this model and within this diagram is that we have different types of variables. So we have control variables, and what we think of when we think of control variables, demographics and disability variables, we consider them control variables or attributable difference variables. And what that means is when we look at an employment outcomes in relation to these things, we're really talking about, well, what are the differences between people grouped in these ways? And there's not an intervention to change race or change ethnicity, for instance, but we can look at how the outcomes vary and maybe target interventions to one group or another depending on their outcomes. So the second set of factors are what we call policy variables or policy effects. What they really are more variables that are more open to change. They may reflect an individual's characteristics, their personality, interests, which are conceptually related to the outcomes more closely, things that may one way or the other become a focus of an intervention. So behaviors, their health, environmental supports and barriers. So these may be addressed at different levels. There are two types of employment outcome categories that we're going to acknowledge. One is participation outcomes, as I alluded to earlier, things like years in the labor force, hours working, job lapses. Is someone working continuously, or are they having setbacks and times when they're working, not working? And then quality outcomes, and quality outcomes being things like earnings, job type, those types of factors. And I'll talk just a little bit more detail about each of those. Next. So this slide again simply elaborates and lists out the parameters that I have just noted. Next. So demographic and disability characteristics. It's common to use things like sex, race, ethnicity, marital status, which is also very much of a social variable. And then specific with MS, we've used multiple indicators, course of MS, whether it's relapsing, remitting, primary progressive, secondary progressive, progressive relapsing, the MS symptoms by type of symptoms or number, cognitive symptoms, and then some of the ADL items. I'm only going to talk about a couple of those today. Next. Psychological factors, again, beyond the intention today to get into detail, but to let people know what has been developed. We have developed a listing of 10 employment considerations. They could be called work values, things that people put a priority on. They're important to get at work. Things like compensation, benefits, getting a good feeling from work, enjoyment from work. And then things like satisfaction with employment. Although this really is more of a career outcome. We've noted it here, but it really is more of an outcome, but the point being with that we've been able to line up satisfaction areas with the individual's needs and employment considerations. So we're measuring essentially both sides of the coin. So on the one hand, we have people saying, well, this is what I need, this is what I value, this is what's important to me. And then secondarily, am I getting this? Or to what extent am I getting this? Next. Environmental factors is a broad group of considerations, and I'm just going to talk briefly about them. So again, that you have an idea of what's in our model, because those are all things that are going to be analyzed and published moving forward, even not if covered in detail today. And they are things that can really make an impact on people's lives and their employability and their salary, and we'll see a little bit of that today related to education, but also VR services. VR's in an obvious, incredible position to affect people's lives, and certainly VR is the reason that I'm here today. Is that I grew up in Minnesota, and they took me to the end of my education, prepared me for everything I'm doing today. So, I'm a big proponent of VR services, and it is something we're looking at in our research, although again, not today. Job accommodations. So, what does somebody need? What are they getting in terms of the very specific accommodations, which can be costly, or they can be as simple as scheduling changes and some flexibility in work environment, and then barriers and facilitators to employment. Talked about that in detail at the State of the Science. I won't repeat it. I know that's available, but we do see different patterns of facilitators and barriers between populations, such as, or specifically SCI and MS. Next slide. So behaviors and the sorts of things that we would typically conceive or conceptualize as behaviors would be, is the individual actively looking for work. Um, so other things would be their preparations for work. So we don't have it listed here, but there is a set of items in our study where we look at, have they prepared a resume? Have they scanned the newspaper? Have they done a particular type of training? Or have they gone on a job interview? So again, when we think of employment status, I think we often overlook, when we look at an employment rate or an unemployment rate, where people are within the process. So if we're going to affect the employment rate, it's going to be a vastly different thing to do if someone has done those steps. They have prepared a resume. They are actively doing the things that someone needs to find employment versus those who have not or are not doing that. And what I would say is if people are not doing those things, then you have a much longer distance to travel to get to employment. And realistically, interventions might simply build those skills with people or get them to take the first step. Next. Without question, health factors are of great importance to the employment of people with physical and other disabilities. And it's something that is not the central component of this study. We have looked much more at quality outcomes and some of the other types of factors that we've discussed, such as the development of the scales related to people's needs and satisfaction, and much more detail on barriers and facilitators. But clearly in our future work, we will be addressing health in greater detail. And health goes beyond the disabling condition itself to the various aspects that co-vary with health. So individuals' general health, physical health, mental health, are they having hospitalizations? Do they have fatigue? These factors, at least in general, are things we have looked at in our research, but a much more comprehensive look needs to be taken at how health varies among people with MS and other conditions, and how that relates to how well they do in an employment circumstance. And again, that's something for future research. And so some of the employment outcomes we look at and have looked at in our research: employment at diagnosis, how does it change after diagnosis? What are people currently doing? Then we look at the cumulative employment indices, and one of the things that is on the horizon is looking at time to retirement among people who have had stable employment, and other similar indices. But retirement and timing is a big outcome, and it does relate to quality. Can people stay in the labor force? And how long do they do that? Next. So the purpose of what I am going to talk to you about in terms of analyses today is to apply, again, our global purpose of our research program is to apply the econometric models to key quality outcomes among those with MS using the data from the Quality Employment After MS study. That is the study we've done as part of the VCU Rehabilitation Research and Training Center. We're going to summarize a couple of econometric analyses related to employment status and earnings. And we're doing so today not to give you a final analysis of earnings, but to show you there are different ways of doing this, and we're going to use our actual data and demonstrate this today. And so the ultimate goal of this is all to lay the foundation for targeting interventions to those in need and identify the factors that are needed to be addressed to optimize interventions. Today, we're only going to report some of the basics. One outcome, salary, but you can see how things line up by the end of today. Next. So again, the data sources, we today are talking about 2 independent studies. The MS study is part of the Research and Training Center, 1,324 responses within that data set, and then the National Multiple Sclerosis Society data by Dr. Rumrill, which are the latter analysis, the Econometric, will actually combine the 2 studies. So rather than simply analyzing data similarly for both studies, reporting it distinctly, we've combined the data, and then we have data from 2 very distinctive sources. Next. So the MS RRTC study. Next. So the data were collected via mail and web self-report. We had a red cap survey that some folks really like to fill out, and the others were obtained by mail, the majority by mail. And it had the multiple sets of predictive factors, which include the demographics and disability, psychological, environmental, and job-related behaviors. All the participants were at least 18 years old, less than 65 at the time of their diagnoses. So if this were spinal cord injury, it would be by injury date, but here it's by MS diagnosis. It's a little more difficult with MS because individuals are not necessarily diagnosed at the time the symptoms start. Usually there's some period of delay. And so within our work, we needed a reference point. There's nothing as concrete as date of injury with a spinal cord injury, but we utilized the date of diagnosis as the primary variable. Next. So our target for the study was 1,050 responses. We exceeded that with the final number of 1,324. And again, the eligibility requirements one was, again, not retired before MS diagnosis. So that was one of the things that was an exclusionary. And the data, again, were collected through mail-in and web assessments. Next. This is a summary of the demographic characteristics. So the average age at diagnosis, 36.8. So again, this underscores that the symptoms are starting to occur even years before that. And you can see there's a group that's really in that core window of employment, an average of 12.3 years after diagnosis. And really a fairly highly educated group, 15.2 years. We want to thank our collaborator and partner at the Shepherd Center who have helped us with this research. And this is a clinical cohort from the Shepherd Center. So this is, unlike the MS Society study, where it is volunteers and people who are part of that organization, this is a clinical cohort. So very different in the sense that identified among people who are being treated, actively treated for their symptoms, or have been actively treated through the clinical institution. And I just want to give a little bit of an overview to help people understand the nature of the study sample and some of the basic outcomes is before we get to our major econometric. And you can see the vast majority of people are relapsing, remitting, and then smaller numbers of primary and secondary progressive and progressive relapsing. And this is fairly typical. Next. So these are the employment rates at 3 months, 1 year, and then current to the study. And this is the decline that's often noted with MS, and you can see the rates dropping to under 50% by the time of our study. And employment rates by diagnosis are interesting to look at. We have reported this previously, so I will only gloss over this, but at 3 months you can see not a lot of difference in employment rates. Next. By 1 year, you can see a little bit different pattern emerging. And current employment, so you can see that those with the relapsing, remitting, best able to maintain their employment. But for the other groups, it drops off dramatically. And again, no bar for progressive relapsing because we had no employment individuals in that group. So I'm not going to talk about employment considerations and satisfaction other than to just barely note or briefly note that among the 10 items, one of them was salary, and since actual salary is one of the focus or one of the primary outcomes within this presentation, just to show that salary-wise, when you look, that's very important to people. Actually, 34.7%, extremely important, 39.5% very important, and relatively few people say that it's either not important or only somewhat important. So you see the value people put on salary. However, when you look at the satisfaction levels within our participants, you can see that they are substantially lower for, especially at the extreme. You know, there's only 15.5% that are very satisfied, although when you look at the satisfied category, between those two, people are relatively satisfied, but not quite to the levels that that are reflective of the importance that people put on salary. It's hard to do an MS presentation and not at least touch on disclosure. So I'm going to just present a little bit of data and just to show that within our study, we asked about disclosure to the employer, to direct supervisor, and to coworkers, and the rates were really relatively the same, regardless of that group. But you can see that a lot of people have not disclosed, and so still about 25% of the people have not disclosed anything about their MS. They're working basically with people with no knowledge of their MS, and therefore no requests for accommodations. You have to disclose to make a request, obviously. And so we found this interesting in our data, and since this is our last webcast of this cycle, we wanted to share this. And we similarly wanted to show two other aspects of disclosure. So asking how concerned people would be, and it really varies, but you can see a portion of people are either concerned or very concerned. Some people, again, a lot of people have disclosed, so they're not at all concerned, but about 55% report that, but that still leaves a very large portion of people. We don't know much about who is disclosing and who is not, and so it remains a key factor within the process of retaining employment with MS and obtaining employment. And lastly, how likely is it that people will disclose either their diagnosis or their complications? And people may disclose some things and not others. You can see that still a portion of people, over 10%, highly unlikely, still less than another about 15% or so that it's unlikely. A lot of people don't know. And again, there is a group that is comfortable disclosing, but they are the ones, if you disclose again, they are able to then request accommodations. So that's why it's such a critical issue. Next. So just an overview of the MS Society data. And again, we combined our data with this data. So the data were collected by mail, phone, or web support, web self-report. There was an oversampling of African American and Hispanic Latinos, and the sample was just under 2,000. And all the individuals were members of at least one of the chapters, and they had documented diagnosis of MS. So the documented diagnosis is similar between the studies. Next. So there's a comparison to demographics. I'll put it up there. And basically, they were relatively similar in a lot of ways. And so even though the MS Society study targeted minorities, there was actually a higher percentage of African Americans in the study that is conducted as part of the Rehabilitation Research and Training Center. So others you can see here, and you can go back and look at this if you would like, but basically just outlining, for the most part, similarities in course of illness and nothing dramatically differing between the two studies in terms of those factors. So fairly typical or representative of MS. Just a quick slide on the employment rate by sex. You can see actually a little bit different trend between the two data sets. Next. Employment status by race, ethnicity, and I'm going over these things relatively quickly. We have covered them previously, and again, I'm just providing them for contextual factors for those who have not seen those previous presentations. And not surprisingly, the higher rates among white non-Hispanics and high rates among Hispanics with lower rates among African Americans. And employment by cognitive difficulties, we used in our study, the Research and Training Center study, we actually used items, some of the items that were used by Dr. Rumrell in the MS Society study. And you can see the employment rate being almost linearly related to cognitive difficulties in our study and in the Rumrell study of the MS Society. Little difference at the top end, but very similar patterns. Next. And this is a grouping of annual salaries, and it's broken down into some general groups so that we can present it in graphic form today. And you can see that it's skewed toward the lower salaries, and these are among people who are employed. Some higher level salaries, about 10% above $125,000. And general similarities in the MS study, a little higher earnings in the 25,000 up through 75,000 category, but at the high end, a little higher in the Research and Training Center Quality Employment Study. So now I'm going to cover the econometric modeling of the data. And the econometric modeling is very sophisticated methods where we look at the data and attempt to break down different components. So I'm first going to cover the two-part probit model. I could tell you what that means, but I'd actually need our econometrician to be here and break it down. In all seriousness, a very complicated method of doing the estimation. And so what I'm giving you today are really using our data to demonstrate two different ways of the econometric modeling. The general results are going to be the same, but some of the specific numbers are different. So basically what we do is that we identify the probability of employment, and this is done through a probit model. We do the probit model, then we look at the probability of employment. We use a regression model to regress on dollars, and so then we again do a hypothetical or counterfactual exercises, Dr. Terza calls it, where we set a parameter and then an employment parameter as employment status, and then look and can manipulate the model to look at potential earnings for different cases based on those parameters and employment and group membership. So again, the disclaimer is really that although the example is using the actual data and is using the probit modeling, it's not a final model. So one thing that was done within this model is we have different groupings of earnings. So one of the factors that needs to be dealt with is when you collect data, it's very difficult to get exact levels. So people are much more comfortable telling you that they make between $75,000 and $999,000. Getting accurate data without producing missing data, you need to use categories and not ask for point estimates typically. And that's basically what we have. We have categories, and so the categories at the lowest level was less than $10,000, and at the highest level was greater than $175,000. So simply for the point of illustration and a model evaluation, we have set the lowest group needs to have a value in a probit model. It's set to $1 if they said less than $10,000. If it's more than $175,000, it's set to $1 million. So the goal of this is at the extreme and for the purpose of model illustration. It's done for our own work, and then after this I'm going to cover a different model that leaves those both ends open statistically and produces a much more modest estimate. And so we ultimately will get the models to converge, and that's what we will report in the literature. So what you see with values today, please do not cite. They're here for illustration, the purpose of the presentation, and to give an idea. And you can see the direction of the findings and how these things relate to each other. But the absolute values at this point, we ask you not to use. Next. So the first part of a two-part probit model needs to estimate the probability of employment. Thanks. So I'm putting the probit estimates up. You can see the significance in the last, and these are things that would be significant in the equation, and we ultimately will link these to the probability of employment in an upcoming slide. But I debated whether to include the first two tables. They're there for anyone who has a sophistication in statistics that really wants to look at the detail. Next. And this is a continuation of variables. So we're looking at things all the way through education level to the symptoms of MS and to the diagnoses. Next. So the second estimation is the group regression of parameters in the second part of the model. So these are simply the regression results, not the application of the earnings estimate, the earnings being a continuous variable. Although in multiple categories, I believe we had 20 categories, 15 to 20 categories. The regression develops the parameter estimates, and we ultimately use this information in the generation of the earnings estimates. So I will gloss over the actual estimates, but this is what we use. And again, we have sample only, so people know that when they look at the tables. But these are some of the preliminary estimates, and they ultimately will be reported in a manuscript, although we will change some of the assumptions with the parameters related to the low end and high end wages. Next. And next. Okay, now the utilization of those probate estimates in terms of probability of employment. And so as we look, and I'll go through this in a little more detail, so looking at the things that are significant. So these are the probabilities of employment. And so a little bit, we do see a cohort difference between our two groups with a little bit of a higher likelihood of employment among those taken from the clinical setting at Shepherd. And so as we go through, we can see, compared to those with a diagnosis of under the age of 30, those highlighted, bolded, being lower likelihood of employment among those in the 40 to 50 age range, and lower yet at those greater than 50. So time since diagnosis, also statistically significant, and not surprising, the longer the time from the diagnosis to the follow-up, the lower the probability of employment. So these are interpreted as differences in probability. And so those are the difference. So for instance, time since diagnosis, greater than 20, 20% less likelihood of being employed at the time of the study. So we do see lower likelihood of employment among non-Hispanic blacks and other racial group. Hispanics, we did not see any differences, and the reference differences with whites, and that is the reference group. So in terms of marital status, the best outcomes for those who are married, the worst for those who are widowed. Next slide. And so the next variable is educational status. So you'll see, again, not surprising, very consistent with earlier research. You'll see that there is a gradation when compared to people with less than a high school certificate. Those with high school or trade school, 12% greater probability of being currently employed, to bachelor's degree up to 22%, 28% for postgraduate degree. So symptoms, people with no MS symptoms currently, they're doing much better. That's the reference group. So compared to that group, those that have some symptoms affecting functioning, they have a much lower probability of employment. And as the functioning is, there are more symptoms, again, the probability of employment decreases. Those with primary progressive or another form of progressive relapsing have a much lower probability of employment than those who have relapsing remitting course. So those with an unknown MS course, actually that's a tough group to discern their outcomes, because there is not a clear diagnosis, and they don't do as poorly as those with progressive MS. And then lastly, with cognition, moderate to total cognitive disability, much lower probability, a 12% lower probability of employment. And those findings are concrete. They're based on the probate model. So now we'll talk about estimated earnings for those who are employed. So when you use a probate model, you can combine, you look at the probability of employment, you look at then the earnings among those who are employed, and then you can put the two things together to use zero earnings estimates for those who are employed. We're not going to do that final modeling step today because this is for demonstration. And so what we will do, and what we've done here, is we do the estimated earnings for those employed. Now you need to keep in mind the caveat that for those with less than 10,000, just again for the purpose of the estimation, was set at $1, and for those 175,000 is set at 1 million. So the actual dollar estimates are going to be affected by that. And that's why we're going to present a second econometric model and talk just briefly about the differences. So the estimate then, you can see how the modeling can put dollar estimates on the various components. So this is, again, is among people who are employed. So you can have an effect where a variable affects the likelihood of employment, and within this you can look at the non-Hispanic blacks or African Americans having $11,000 plus of a deficit in earnings. Again, please don't take the absolute value, but making significantly less money even if they are employed. And that's the point of the model. Same with widowed. So you'd think, well, someone's widowed, they're less likely to be employed. That's true. But they're also less likely, or they're likely to make less money if employed. So those things are estimated differently, and you can see the influence of both. Next. Now the estimates again for the education are strongly affected by the high-end use of the top category being 1 million, and so these are inflated, but you can see that each is related to earnings. So in essence, employment relates to a greater likelihood of employment, but greater earnings among those who are employed. And again, compared to people with no MS symptoms, you will see that people who have symptoms, they're going to make less if they're employed. So again, they take it sort of both ways and are, have poorer outcomes in both ways. Now the next two were not significant related to MS course, but it was interesting that the trends were for higher income. So the course, although affecting the likelihood of employment, at least from this analysis, did not affect the likelihood of making a good salary, and actually a little bit of evidence that maybe the people that were able to overcome their course and stay employed really did so at a good level. And then lastly, as we'd expect, the cognitive symptoms were related to not only the diminished likelihood of employment, but if people were employed, they were likely to make less money. So lastly, I'm going to talk about interval regression. And interval regression is different than the probit models that we just reported on. Next. So in a nutshell, the difference with interval regression is that it basically uses both ends of the category. So if a category is 10,000 to 19,999, it estimates on both ends of those continuum, and it leaves the extreme categories undefined, and goes through this statistical process. And so again, I would need the statistician to explain the finer points of statistically how that's handled, but the important point is that the difference between this and the other model is that whereas the other one assumes the extreme, or at least we did for the point of demonstration, this one does not assume anything on the ends. It leaves it undefined and works its calculation. And our goal is to work with a model with the probit until we can see how the two models will sit side by side. So we'll narrow that focus within the probits. We'll change those estimates up for the low category, certainly down considerably for the high category, until we can get convergence between models. When we get convergence, then we'll know that we have the stable models. So the estimates, not surprising, using the interval regression are not as extreme. Next. So we can see here, and we did leave sense values. It's a little more difficult to look at, but you can see that with different ages at the 40 to but less than 50 year range, a higher estimate of salary. You can see again that African Americans, lower salaries, similar to the other analysis. The same with those who are widowed and never married. You can see those ranges. And then with education, you can see that you still see the effects of education on income, and they still are very profound. So in our earlier studies with spinal cord injury, we didn't have as wide of a salary range, so we didn't find as wide of variations or as strong as effects because we were using income data matched to the BRFSS, where the top category was $75,000 and greater. And we broke those categories much more into more groups and more detail for this study. And you can see the effects of just having some additional education and certainly the strong effects of a 4-year degree and its influence on earnings. You do see lower earnings, as you'd expect with more symptoms. And again, you see a little bit different trend with the diagnoses, where the diagnosis affects the probability of employment. It does not appear to affect salary among those employed. And also you do see the significant effects of cognitive symptoms. I'm going to actually wrap up with my concluding statements. I have a slide that's slipped in from there. Okay, thank you. So just in conclusion, we can see just from this analysis in looking at employment, the types of factors, we can see the disability factors, we can see the demographics, just seeing their strength and their relationship with employment, and one quality outcome, which is salary. Now, we have a lot of narrowing to do because of some of the assumptions that are made, but you can see how and which factors affect not only the probability of employment, but which also affect the amount of earnings. So this is the first econometric analysis to come out of this study. We have a more general report of global outcomes coming out in Journal of Vocational Rehabilitation. But this is the first step, first modeling. And as we work with the data, we also are going to increase the number of factors we look at in relation to even salary. One of the limitations in the current analysis is we had the benefit of merging with the larger data from the MS Society that increased the cohort size. The downside of that is we're limited to variables available in both data sets. And for our future econometric models, we will use the full scope of data that's at our disposal. So please look for updates. We're going to be publishing this. You can see a great deal coming out of this in the very near future, and we will and are working on ways to translate this data for policy and also for interventions. Thank you very much.